This is Irene Hamrick with a presentation on vitamin B12, New Understanding and Approach to an Old Problem, with an animation by Alan Brannigan. The physiology of absorption is dependent on many steps, including in the saliva, the stomach, the duodenum, jejunum, ileum, and then serum transport in the portal system via transcobalamin. This animation explains the steps of absorption. Vitamin B12 is bound to proteins in the food that we ingest. As we eat, the R binder or R protein is released with the saliva. In the stomach, pepsin is activated by acid, and pepsin splits the B12 from its protein binding sites, allowing the attachment of the R binder to vitamin B12, which transports it to the duodenum. The intrinsic factor is released from the parietal cell. In the duodenum, the pancreas releases proteases, which split the R binder from the vitamin B12, allowing the B12 to attach to the intrinsic factor for transport to the ileum. In the ileum, it attaches to the enterocyte to be absorbed into the portal system and is transported via transcobalamin 2 to the liver.
You could instantly recognize this as being spinal cord. I will instantly tell you the name of the disease. It's called subacute combined degeneration of pernicious anemia, and pretty soon we'll know why. I think you could recognize that this is the ventral part of the spinal cord and that this is the dorsal, and that the general area here forming the H is mostly gray matter, and the white matter is the blacker areas between inside and outside of the H. Here's the H. This is gray matter, chiefly neurons. This black area and this area, which is white as well, is a myelinated area. So these are tracks, either ascending or descending of various names. This black area is supposed to stain myelin very nicely. This is not a H&E stain. This is a myelin stain. So it's the entire ascending and descending tracks, because they're chiefly myelinated, are supposed to look like this, and they're supposed to look like this. But you'll notice wide zones in the cortical spinal tracts laterally and in the posterior columns as well, and also here in the ventral or anterior cortical spinal tract, that there are large areas of demyelination. This is a demyelinating disease, and it should be entirely black everywhere you see white area, because these are myelinated fibers. They should be black, but they've lost their myelin. And this would be a severe case of pernicious anemia, long-standing, due to vitamin B12 deficiency. And the reason why it's called combined is because it affects both ascending tracts, which of course you have predominantly in the posterior columns, including the vibratory sense, as well as the descending tracts, these cortical spinal tracts as well, and here posteriorly as well. So all of the area here, which is not black anymore, is not black because it's lost its myelin, and it lost its myelin because of long-standing vitamin B12 deficiency. And that's why the neurologists carry tuning forks in their little black bags, in case you've ever wondered, is because one of the earliest senses to suffer is the vibratory sense, carried here in the posterior column. And with this area being damaged, one thing that might be present is loss of your vibratory sense.
หลับตาไว้ตลอดเลยครับโอเคลองกอดอกครับกอดอกไว้ตลอดเลยนะแล้วก็หลับตานะครับหลับตาครับหลับตาไว้ตลอดเลยครับเดี๋ยวถ้าเกิดล้มเดี๋ยวหมอเขาจะอุ้มไว้เลยครับไม่ไหวเนาะไม่ไหวนะครับเดินนะครับน้องตั้นเอาขากางเกงขึ้นหน่อยดิน้องตั้นระวังคนไข้ล้มหมุนตัวครับหมุนตัวครับยืนครับหมุนตัวอีกทีหนึ่งหมุนตัวอีกทีหนึ่งครับโอเคกอดอกหลับตาอีกทีหนึ่งได้ไหมครับโทษนะครับหาคนปิดตาคนไข้สักคนหนึ่งนะปิดตาไว้เลยน้องตั้นปิดตาไว้เลยแล้วก็หากอีกคนหนึ่งล้มอีกคนหนึ่งกันไว้โอเคพอแล้วขอบคุณมากครับ
Welcome to Q Sprays. This is an opportunity for you to learn about a powerful new product and a delivery system unlike any other. We offer the Q Sprays now with B12, one of our flagship products. With the advent of B12 deficiencies out there, unlike having to take a painful injectable or sublinguals where you have to put them under your tongue and hold and then swallow, we now offer a powerful intraoral spray mist developed by renowned Dr. Clive Spray exclusively for Q Sciences. This product, literally for 50 cents to $1 a day, you could supplement with pharmaceutical grade B12 in a spray. If you notice, it's a fine mist. Now, you wouldn't throw it into the air. What you do is you line it up with your mouth. Anywhere within the lining of your mouth, the tongue, the sides of the mouth, you have what's called the buccal mucosa. This is designed to permeate that and get into your bloodstream as quickly as that. Tastes great. It is designed with 240 metered sprays. Every spray is backed up by Q Sciences, and we have the worldwide distribution with them with Q Sciences. So with that, go ahead and spray away and try this powerful product.